This is an ECG of a 58-year-old man who was referred to the cardiac clinic by his general practitioner. Let's look at the ECG. Looking for P waves, they are probably easiest to see in the lead V1 rhythm strip. We see that the P waves are regular, and that the P waves are positive in lead 1 and in lead AVF, suggesting that they originate from the sinus node. Is there a QRS after each P wave? No. In fact, every third P wave does not have an associated QRS complex. Let's look closely at the relationship between the P waves and the QRS complexes. This P wave is conducted to the next QRS complex with a long PR interval of about 300 milliseconds. The next P wave is conducted with an even longer PR interval. The third P wave is not conducted at all, and there is no QRS complex associated with this P wave. The next P wave then starts the whole cycle again. Conducted with a longer PR, not conducted, and the cycle continues to repeat itself throughout the ECG tracing. This type of conduction with gradual PR prolongation, followed eventually by a P wave that does not conduct to the ventricle, is known as the Wenckebach phenomenon and indicates an abnormality of conduction in the AV node. This type of AV block is called second-degree AV block, which can either be type 1 or type 2. When the Wenckebach phenomenon or gradual PR interval prolongation occurs, this is second-degree type 1 AV block. It is easy to remember because Dr. Wenckebach is always number 1. Finishing the rest of the ECG interpretation, we see that there is no evidence of left or right atrial enlargement. The QRS axis is positive in lead 1 and positive in AVF, suggesting a leftward inferior axis, which is normal. Because the QRS complex is narrow and sharp, there is no evidence of any intraventricular conduction delay. The voltage of the QRS in the limb leads and the precordial leads is normal with a normal axis, and thus there is no left or right ventricular hypertrophy. Here, there is no evidence of any abnormal Q waves, and there is normal R wave progression from V1 to V3, suggesting no evidence of infarction. The ST segments are normal, and the T waves are positive in lead 1, AVF, and V2 to V6, showing a normal pattern of repolarization. Overall, this ECG shows normal sinus rhythm with second-degree Mobitz 1 AV block, with a ventricular rate of about 60 beats per minute.